Greetings and welcome to another lecture in psychopathology. This particular lecture is going to deal with the possible ranges of treatment for a particular substance-related disorder, specifically alcohol. Now, it's very difficult to treat this particular disorder. It's often called a disorder of denial because people who do abuse alcohol or who are dependent on alcohol very often say, well, it's not a big deal. It doesn't really bother me. I can handle it. I'm fine. There's nothing wrong with me. And so there's an awful lot of denial until sometimes it just takes a significant event to open people's eyes for them to be able to see just how much their lives are sort of being controlled by alcohol. But once people have agreed to undergo treatment, there are a number of different methods. Unfortunately, none of them work perfectly. And while this is true of all disorders, when a disorder is as dangerous as this one, it can be a problem. There are various sorts of medications that have been used to try to get people to stop drinking. The classic medication that has been used is a drug called Antabuse. And what Antabuse does is it stops the breakdown of alcohol in the body. Alcohol, as I've said before, is a poison. It is something that your body can gradually detoxify. However, what Antabuse does is it, at least temporarily, stops that process. So the alcohol poison sticks around and it sticks around and people just get sicker than they've ever been in their entire life. The idea is, therefore, that they will no longer wish to drink because they got so sick or because they always get sick when they drink. The problem is that humans have a little bit more control over our classical conditioning than one might be able to think. And in fact, when it comes to alcohol, very often, unless the alcohol has a very distinctive taste, we don't, for instance, form a conditioned taste aversion to it. And so it's possible for people to drink until they vomit and then, the next day they do the same thing. Like, as I've mentioned before, I used to live in Panama City Beach, spring break capital of the U.S. It was a barfing festival, basically. So it doesn't necessarily work. That, and sometimes people, they just forget to take it. Shucks. Naltrexone, which is not the same as Narcan, by the way. Narcan blocks opiate overdoses. But naltrexone basically blocks that pleasure center that we were talking about earlier, blocks that dopaminergic pathway, and the idea that when you drink, if you're not getting more pleasure out of it rather, then you'll be less likely to drink in the future. Again, it's a better idea than a reality. Benzodiazepines and other tranquilizers can also help with withdrawal because benzodiazepines, like alcohol, are depressants. And so the idea then is to depress the body, just not by using alcohol, and therefore allow the body to basically detox. The problem is, however, that benzodiazepines are also highly habit-forming. It's very, very easy to get hooked on depressants, whether they're alcohol or benzos. And so sometimes what happens is people just wind up, basically swapping one addiction for another, which is not what we're trying here. Psychological treatments, there are a lot of them. And like I said, some of them work better than others. It really depends on the individual. There are various types of group therapy. I'll actually be talking about one type of group therapy in a little more detail in a slide or two, talking about AA, Alcoholics Anonymous. But the idea here is with these groups, the idea is to reduce denial. You can't say, well, it's all these other people have a problem with alcohol, but I don't, when they're reporting the exact same behaviors that you're having. So, and also it's hard, well, it's not a big deal when it is a big deal for other people. So the idea here is that being around a whole bunch of other people with the same disorder might help people realize the problems that they're having. Other treatments may include environmental interventions. An environmental intervention is that if someone is living, in a bad environment, they may use drinking as a means of escape from it. So the idea there is that if you pull them out of that suboptimal environment, then they will hopefully minimize the drinking. They will no longer need to self-medicate with alcohol because of the environment. It might be that the environment is bad. It might be that the environment is full of other people that are drinking, or full of advertisements for drinking, or heck, maybe they work at a bar. And so the idea is to get the people out of that environment in the hopes that that will help. We can also do the classical behavioral and cognitive behavioral therapy. The antabuse and such can work for conditioned aversion therapy, at least in theory. The problem is that conditioned aversion therapy, as I mentioned before in terms of antabuse, don't always work very well in terms of actual classical conditioning. Cognitive behavior therapy, CBT, in this case is called skills training procedure. The idea here is that people will be taught various skills to allow them to hopefully be able to deal with things without alcohol. That you see people that model good behavior and therefore they imitate that good behavior. They change their way of thinking that alcohol is no big deal, thinking that alcohol is a good thing, that they can solve everything with alcohol. Or they stop their way of thinking, about the world in certain ways and learn how to cope in other ways instead of just reaching for a drink. They might learn other coping styles, that sort of thing. It works okay. It's not perfect, nothing is, but indeed it does help some people. So it's definitely worth a try in the hopes of trying to help. Now, one of the big questions is, can people who abuse alcohol continue to drink in a limited fashion? And this is something that has been discussed and debated because a lot of people don't necessarily want to give up drinking entirely. They want to be a social drinker. They want to be able to have a drink or two with friends. But some of the places that help deal with alcohol dependence and addiction basically say, no, you can't. You can never drink again. And that's sort of it. Again, it does appear that some people can learn to control their alcohol intake. Now, this isn't a majority of people. It's not even a significant minority. We're looking at about 15% of people or so long term. Some people may be able to control their drinking in the short term, but then they fall back in on those old techniques. So yeah, that's not a lot of people. That's not a lot of people. And perhaps not surprisingly, it seems to work best when their dependence on alcohol was not that extreme to begin with. If they had a very serious dependence problem, then generally no, they really can't go back to social drinking, and they probably need to stop drinking entirely. One of the biggest proponents of this never drink again philosophy is Alcoholics Anonymous, or AA. And Alcoholics Anonymous is a type of group therapy. There is group therapy where people meet together to talk. There's one-on-one where people have mentors or guides to try to help work the individual through their dependence on alcohol, both physical, hopefully it's a doctor, but definitely psychological, plus abstinence, plus no drinking whatsoever. Now, one of the things that AA does that's kind of interesting is they basically say that if a person is an alcoholic, that alcoholism is a disease. It's not a personal failing. It's not a character flaw. It's not because the person is weak. It's a disease, just like other things are diseases, okay? That it's not the person's fault. And this has actually caught on, at least in some people, to the point that alcoholism in some cases being considered a basis for perhaps disability. Others disagree with this heartily. and they basically say, no, alcoholism is not a disease. It's not like cancer. It's not something that, that you get, that it is indeed something that people can hopefully psychologically deal with. It will be interesting to see where this goes in the next few years. Now, AA has been around for quite a long time. I think it's certainly more than 50 years. However, we don't have a really good idea of whether or not it works, or how well it works, or what the success rate is. AA tells the world things, but we don't know because AA doesn't participate in research. It possibly has to do with confidentiality, or basically the anonymity in these meetings. You are not to speak to anyone else of who you see in the meetings or what you talk about or what happens there. And maybe it's thought that research would sort of damage this. But because of that, because there is no good outside rating to see how well this works, we really don't know what the total success rate is. Like most of these others, I suspect that it works for some people and it doesn't work for others. It just would be really nice if they could get some research done so we could basically point at it and say, yes, it works, and here are the results. Speaking of, here are the results. How well do these therapies work? Well, there are some things that basically appear to make these therapies more likely to work. And again, a lot of these things are going to be just really kind of obvious. It works best when the individual realizes they need help. No kidding. Where adequate treatment facilities are available, ditto. And where the individual attends treatment regularly. I mean, I'm sorry, but that's true for almost anything in the world. That if you do these things, that things are going to end up better than if you don't. So I'm not entirely sure that that is any sort of groundbreaking research right there, or any findings that you're on now smacking your foreheads and going, oh my God, I never knew. Motivated interviewing can also help. One of the things that's interesting is when you only tell people one side of an issue, very often they don't believe you. And it can really help, particularly if it's trying to get people to do something they don't want to do. So it helps to allow the person themselves to figure out the good things and the bad things and why they should do it and why they shouldn't do it and make their own decisions. So again, this probably falls under the kind of patently obvious category that a number of these are in. Relapse is a big thing with any kind of substance abuse, or any kind of eating disorder. There are other things also that have relapses. Relapse is a problem. Relapse is when the person goes back to their prior unhealthy behavior, in this case, drinking to excess. Now, this can be sudden or gradual. It can be, just suddenly the person is like, to hell with it, I'm going to have, 10 beers. It could also be gradual, which is part of the reason I think why AA says you shouldn't drink at all, because then you can't just sort of gradually go, well, I'll have a half a beer. Oh, well, half a beer's fine. And tomorrow, today, I'll have a beer. Well, I've had a beer for every night for that week. I'll have 2. And so the relapse just can be gradual. There's something called the abstinence violation effect. And that is that when people have been abstaining from something, whether it's alcohol, whether it's chocolate, whether it's any of a number of things, once they fall off the wagon, as it were, once they, eat the chocolate or drink the alcohol, very often what'll happen is they'll just chuck the whole thing and end the diet or end the alcohol program and just go out and resume their unhealthy ways. And that, of course, is not the best way to deal with relapses, because relapses are going to happen. I don't know anybody who would never relapse, not human anyway. And so the idea then is, if the person relapses, to make them realize that this doesn't mean they're a bad person, and this doesn't mean that they should throw the whole program out the window. They need to, as it were, to climb back on that wagon. And in fact, some of the better programs that help people to deal with relapses, that have the best outcomes, actually tell people what I just basically told you, that the odds are they're going to relapse, and that when they relapse, what they need to do instead of just ditching the program entirely is that they need to figure out why they did it. And once they figure out why they did it, they need to figure out how they're not going to do it again. So if there was any sort of trigger, if there was anything that made them do it, to just stay away from that or to not do it. To teach people how to handle the relapses. So indeed, they just say, okay, that was a thing, let's move on, instead of saying, well, I've ruined it, I can't do this, I suck, where's the beer? Being able to handle it will work out much better in the long run, because as I said, relapses are going to happen. And from here, we'll move on to other types of drugs. Although, quite frankly, a lot of the things that I'm talking about here will also apply to those other drugs as well.